it's Kristen. Welcome back to my channel. If you are new here, I am a third year in a Doctor of Physical Therapy program, and here on my channel I post a ton of videos sharing and documenting my journey in physical therapy school, and I have been filming since the very beginning, since I was kind of starting to prep to start school. So you should definitely check out some of my older videos, especially if you are starting physical therapy soon here. But today I'm going to talk about my 12-week full-time clinical experience in outpatient orthopedics, just kind of chatting about how it went, everything I did, and also give you guys a little bit of a life update because I have been vlogging a lot recently, but I feel like I haven't sat down and chatted with you guys in a hot second. So that is what we are going to be doing today. First of all, I apologize if my room is kind of a mess. I don't know if you can really see, but behind me there are so many luggages on the floor because if you didn't know, my school is based in Georgia, but my first rotation that I just finished up was in Pennsylvania, close to where my parents live. So tomorrow I am doing the 12-hour drive with my dad back to Georgia because my next rotation is in acute care in the hospital setting. So I'm heading back just for 12 weeks. I have a short-term 3-month, 1-bedroom apartment lease. So I will be going back just for 3 months for my next rotation. And then after that, my last rotation is also back in Pennsylvania. So just kind of a lot of crazy chaos moving around sort of things. So I'm just going to go ahead and start kind of sharing my experience at this clinic. So this rotation was in outpatient orthopedics, and coming off of last semester, I felt super confident in my orthopedic kind of examination skills because in my curriculum, we have 2 musculoskeletal classes, one in the fall and one in the spring, and they kind of divvied up, one of them is a lower extremity class, one of them is an upper extremity class. So we spent a lot of time kind of covering each zone of the body, how to do a full exam on it, and some treatment ideas for it. So I was super happy that I kind of had those 2 classes back to back, followed up by this clinical. If this orthopedic clinical would have been now per se, and say I spent 12 weeks in a hospital and then 12 weeks at this clinical, I feel like I would have gone into it a lot less confident, feeling a little bit rusty, but going into it, I felt like I had just done a big whole review of my skills. So I was feeling pretty good going into this rotation. So if you don't know, for clinical rotations, you are assigned a clinical instructor. So my instructor's name was Stephanie, and I was with her for 12 weeks full time. So basically any patient she had also technically was my patient. So yeah, I kind of shared her caseload with her, and she has her OCS, her orthopedic clinical specialization, as well as her FAAOMP. I may be messing up those letters, but basically she is a fellow of manual therapy. So she has 5 years of further training after physical therapy school, and she literally is the smartest person ever. So she and all the other PTs at the clinic, honestly, 3 of the PTs there have that extra training, and the other ones are going through their residency now. So all of the PTs at this clinic kind of treat at the highest of the highest level, and I wasn't expecting that. I was expecting just to walk into a typical outpatient orthopedic kind of chill clinic, and they just were the most awesome, most knowledgeable PTs ever, really treating in the best, highest level possible. But with that being said, this means that a lot of the ways that they do treat and a lot of the techniques they do use, I didn't learn in school. So I was humbled quite quickly, but I learned so much, and so much kind of higher level stuff that I didn't even expect to ever learn. I just kind of thought I was going to go in, perfect my skills that I learned in the classroom, but I learned so many cool grade 5 mobilizations, which is where you do the quick kind of turning and popping sort of thing. So that was super fun. A lot of other just kind of grade 1, 2, 3, 4, more gentle mobilizations. A lot of cool intervention ideas. If you watch my vlogs, you know that this clinic specializes in jaw pain. So about 20% of the patients that they treat are referrals from dentists for jaw pain. So that was all totally new to me because in my curriculum, all we learned about the jaw was kind of the anatomy and maybe some treatment ideas, but we didn't actually physically do any of the hands in the mouth, mobilizing the jaw sort of thing. So I learned all of that, which was super unique and interesting. I have gotten a few questions about kind of like the logistics of the clinic. So my shifts were either 10 to 7 or 7 to 4 depending upon the day, and we did have an hour for lunch, and this clinic was super good about like actually giving you that hour for lunch. I know some clinics will like book through lunch or expect you to document or yada yada yada, but they were super good about like actually giving you that hour to like decompress. And aside from that, the schedule is one patient every half hour. But the clinic is currently short-staffed, so sometimes it would be 2 patients every half hour. So we were seeing anywhere from like 15, I would say, was like the average per day. Some days were way busier though, like over 20 patients, because it is the summertime as well, so people were going on vacation, and when that happens, like more patients get put onto the PT schedules that are working, obviously. So anywhere from like 10 patients on a slow day, the minimum, to 15 to 20 patients on a busy day. So how I started off week 1 was just kind of getting comfortable with all of the patients, getting comfortable kind of with the way they do things at the clinic. So a lot of observing, like how do they start a session, how do they do an initial eval, just seeing how they do things, because like I said, every clinic is different and has a different way of doing things. And when we did have downtime during the first week or two, my clinical instructor would be like, okay, show me this, like XYZ skills, making sure I am competent and like not just gonna go like attempt to do something on a patient and potentially hurt them. So it's kind of being like quizzed, I guess you could say, behind the scenes, making sure I'm okay with everything. During this time, I also had my own student laptop given to me. I'll insert a little video here, but we all have these little carts where you put like your laptop on so you can wheel around the clinic to keep up with documentation pretty effectively. So the first 2 weeks were also a lot of me like getting comfortable with the EMR system that they used, like opening notes, scheduling patients, typing in patients like subjective history, aka when they come in saying, how are you feeling today, like compared to last session, like any better, worse, the same, what's new, sort of thing. So the first week and a half were very much that sort of thing, kind of slowly easing me in, building relationships with the patients so then I could treat them kind of more comfortably and confidently, if you will. By like week 2, 3-ish, I was starting to do initial evaluations on my own, but with my clinical instructor like right there, kind of directing me if I needed some guidance, popping in with any questions that I missed, things like that. But for the most part, I was doing the evals on my own, which was super nerve-wracking, but with each one I was getting more and more comfortable. And we usually had like 1 a day, sometimes 2, but then again there were days when we didn't have any evals at all. So it really just depended kind of day to day if we were going to have an eval or not. I also started working with probably about like 5 to 6 patients like on my own, again with my instructor right there. If I needed any guidance or anything, turning to her. But for the most part, I was starting to treat a few patients on my own, but never 2 at a time, always just one-on-one for the whole hour, kind of getting me comfortable. Again, I kind of stayed in this kind of routine about week like 3 to 5, I will say. I can't remember exactly, but I was watching my week 5 Week in My Life vlog the other day when I was editing, and I was talking about in that vlog me starting to work on balancing 2 patients at a time. And I'm pretty sure that's right. So at about week like 5 or 6, once I was getting comfortable with the one-on-ones, we then started throwing in the aspect of, okay, like now how do you manage 2 patients at a time, giving them both the attention and the care that they need. So I was slowly increasing my caseload, because the goal by the end of the 12-week experience was me to carry a full caseload for the clinic. And at this clinic, they said a full caseload for a new grad is 10 to 11 patients. So we were kind of slowly working me up towards that. And by week like 7, 8, I was treating about this many patients every single day. Again, with my clinical instructor like right there if I needed, but each week I was kind of consulting with her less and less and less. And it kind of turned into, by the end, me being the PT and she just being kind of like the aide if I needed anything, like, oh, okay, go get me a TheraBand, can you set them up on this exercise, can you set this machine to this level? So it was mostly me by the end, which is so crazy to think about. And as for the types of patients I was treating, I did write a little list on my laptop here, so I'm going to read it before I forget, but since patients come in like 2 or 3 times a week, it is a lot of repeat patients. I saw a lot of jaws, a lot of shoulders and necks, because a lot of the times when patients' jaw dysfunction clears up, it then becomes more evident that their neck's hurting, their shoulders hurting, because it's all connected. So lots and lots of shoulders, necks, and jaws. Got super comfortable with all of those. A few kind of knee post-surgical, like post-total knee replacement, post-ACL repair, post-meniscus repair, that sort of thing. Foot pain, like ankle sprain, fractures, plantar fasciitis, that sort of thing. Randomly, a lot of people that had like rib pain. One patient had teat syndrome, that was super unique. 2 patients with post-polio syndrome actually, which was super unique to see. A few vestibular patients, so like vertigo, vestibular hypofunction, that sort of thing. But really, honestly, it was just a good caseload with a good mix of kind of more like basic PT school patients and a lot of patients that were more complex and were drawn to this clinic because they had tried PT before for, say, their chronic low back pain. It didn't help at all. They found this clinic that had the like kind of fellowship trained higher level PTs and thought they would give it a shot. So working with those patients was always super fun because we got to whip out kind of some more of the higher level skills and treatments like I was saying. But there were days that I would just leave there feeling super discouraged and like I was an idiot and had no idea what I was doing. But in reality, everyone at that clinic was just so smart and so incredible and so highly trained. Some of the days were super tough. I'm not going to try to sugarcoat that at all. But overall, it was super, super awesome and a super good, challenging learning experience that really kind of forced me to grow and adapt pretty quickly. Like I said, I did vlog a ton of this clinical experience, so if you want to kind of see more day-to-day, week-to-week type of stuff, you can check out those vlogs. I also vlogged my last week, which is my most recent upload, and that week was just so sad, like saying goodbye to all of the patients that I had gotten to know super well and connect with on a pretty personal level. Saying goodbye to them and knowing I probably won't ever see them again just was so sad. Some of the patients were crying, I was crying. I got the sweetest gifts from some of the patients, and I just don't know how PTs do that on a regular basis, like saying goodbye to sweet, sweet patients. So that was pretty sad. This experience really just confirmed to me that I chose the right healthcare profession, because a big reason I was drawn to PT was for that kind of relationship building, forming sort of aspect, and it was just super rewarding and just so fun to go in every day and get to interact with the patients, spend a full hour with them, and help them leave feeling better, feeling in less pain. So it was awesome. And I just want to say, if you are watching this and you are just starting PT school, or maybe you're just about to start your first clinical, I feel like you'll never get to this point, I just want to say I totally relate, and I felt the same way. But you will get there. You just have to show up every single day, listen in class, ask questions, put your best foot forward. I haven't really talked about this much on my channel, but I do go to therapy on a pretty regular basis, and I have been for a few years now. And I was talking to my therapist yesterday, kind of telling her everything I just told you guys, just how my experience was and kind of what I did and such. And she was like, Kristen, this is huge. Do you remember the girl that started with me 2 years ago and had like no confidence in herself? Like, look at you now. So that's gonna be you. If you're watching this video, just keep putting your best foot forward. Be you, be personable. If anything, the biggest takeaway I took from this experience, if you are kind and have a good attitude and you just want to help people, the patients are going to be super receptive to that. They're not going to care if you are a student, if you are just nice to them and treat them well. Just be nice, be a good person. Moral of the story. I also had to choose one patient from this experience to do a case report on, because next semester, in addition to my clinical, we have to work on our big final case report, which we will present in December. So the whole experience, I was so stressed trying to pick the perfect patient, because I really wanted to do it on a job patient, which is unique, but a lot of those patients are there for like years or progress super slowly. But finally, I found a patient that I did the eval. Within 10 visits, she was like better. So I found the ideal perfect job patient to do my case report on. I'll probably share more. Probably will film a whole separate video about my case report. So not going to talk about that too much, but thought I would throw that in there because it is related to this experience. I think I hit on all the main points I wanted to touch on in this video. Like I said, I just have 2 more semesters left of school, so I'm going back to Georgia tomorrow. I'm taking my Herman and Wallace pelvic floor class this coming weekend, which I actually am vlogging for you guys as well, so that will be up soon. I have to go back on campus for just 3 days to kind of recap. Then we head off and start our next 12 weeks of clinical in the hospital setting. And then come November, I'm going to be moving all of my stuff back to Pennsylvania for good because I am moving here for post-grad, and my last 12-week rotation starting in January is here as well, and that is my pelvic floor rotation. So things are wrapping up here, and it is absolutely crazy. So I'm just trying to enjoy my last little bit of time as a student. I wanted to thank you guys so much for watching this vlog. And again, if you are still in kind of the curriculum part, keep pushing. You're gonna have so much more free time and so much more less stress once you're in clinical. I had so much more time to hang out with friends, socialize, go on weekend trips, work part-time if you desire. I started babysitting, dog sitting, and cat sitting, and doing YouTube kind of more because I have more time for hobbies now. Keep pushing, you guys got this. Please be sure to subscribe down below if you guys enjoyed, and I will talk to you guys in my next video. Bye, friends!